welcome back. So this week we'll be doing the 9 principles of being a part of the dental team. So this is according to the GDC, which is the General Dental Council, and what they do is that they are a UK-wide regulator of members of the dental team. So they check everyone, any dental professional that comes into the career, they check them and make sure they're maintaining the standard as to maintain the public perception of dentistry and also patient perception. So the first principle is to put the patient's interest first. So ideally you want to be listening to them, you want to be knowing what kind of treatment they want to get done, and you need to provide a holistic approach to each of their procedures and their treatments. So for example, whilst I was in work experience, there was one person who, his mum was concerned about his GCSEs. So he was going to do a GCSE music qualification. For that, obviously, you would need to play an instrument, and he was scared that he wouldn't be able to because of him getting braces. So the orthodontist would then talk through the procedure and any alternative approaches which could have been done. So that's a good example of this. Next is communicating effectively with patients. So making sure that the way that you're explaining the procedure is clear and you're putting all the details in front of them in order for them to make a choice. So you need to remember that they have the ultimate decision and rights to what procedure or what is done to them. So they have complete autonomy, you would say. And also you need to provide them with all the information they may need to make an informed decision. Next is to obtain valid consent. So this is important in all areas of life, not just dentistry. So you need to explain all the relevant options regarding their treatment and also make sure that they understand the process each step of the way and they understand what decisions that they are being asked to make. And this is important throughout the whole procedure, not just one part. And the only time that this could be breached, so if you were to share patient information without their consent, the only time this could be done is if you think that they might be a victim of abuse or something's going on and you would need to share that kind of information with the valid authorities. And that ties on to maintaining and protecting patient information. So you need to ensure that no one except the patient or anyone involved in their care gets access to their information. Even, say, their spouse, you need their consent to be able to tell their spouse what is wrong with them. And that's only, obviously, it's only released with their consent. So if they need to be in the room and give you valid consent saying, oh, it's fine if you share my information with this person or that person, in that case you're allowed to. And you also need to keep the patient information secure at all times to ensure that it doesn't get into the wrong hands. And you need to have a clear and effective complaints procedure. So you need to listen to their concerns, acknowledge where they're coming from, identify relevant problems of where their concern might be stemmed from, and you need to figure out an approach which not only suits the patient, but also it ensures that this doesn't happen again, and also maintains the public perception of dentistry, and you need to obviously leave the patient feeling satisfied when they leave. And you also, it's very important to work with colleagues in a way that's in the patient's best interest. So, for example, you need to be working effectively and have good teamwork within your the members of your team to be able to give the patient the best care that's needed. For example, in my work experience, I saw that the different members of the dental team, they all knew what was going on. They were all friendly with each other, all happy. There was no sort of tension going on, and that's really important in maintaining an environment which is safe for the patient and for your colleagues, so that if they have any concerns, they can voice their concerns to you, or if the patient has any concerns, they can do that to you in a safe environment. And another one is maintaining, developing, and working within your professional knowledge and skills. So as a dentist or a member of the dental team, you will need to be able to, you will need to know what is going on currently in dentistry. So any types of new procedures that are coming out, you need to be aware of them, or like any type of knowledge that you might not be aware of, you need to keep up to date and therefore obviously provide good quality care. And that would need to happen throughout your working life, so not just after you pass dental school. you need to do it as you're going on and progressing in your career. And you also need to raise concerns if patients are at risk. So this is, again, if you feel like your patient may be a victim of abuse, then you need to raise concerns with the relevant authorities, and you also need to create a team which knows all of these rights and you know the law, so that you can act accordingly depending on if your patient is at risk. And the last one is to make sure your personal behaviour maintains the patient's confidence on you and the dental profession. So you need to make sure that the way that you act means that you keep the dental profession in a good light, and that would obviously protect your patients and your colleagues. Your patients will trust you more, so they would obviously be open to having more dental treatments, and also your colleagues, so it wouldn't have a negative effect on them based off of what you do. And you need to cooperate with your patient and colleagues, and comply to any formal or informal inquiries that may be given by the GDC or any other good authority, and give the full truth at all times if there is something wrong. And that's all of it. Thank you for listening.